Or is it a teary mess? That's what we'd like to know. Tears of joy or a teary mess? So you can text us on 87222, start your message with the word Times, and you can tweet us at Times Radio, or you can email us on studio@times.radio. Okay, let's get stuck into the show. We've got the news hour now, and we really want to go into the rule restrictions over Christmas and the fact that the 5-day restriction means that some very important scientists have come out and said, look, it doesn't make any sense. You risk the infection rate doubling if you allow the rules to be a little gentler over that 5-day period. The R rate currently sits between 0.9 and 1, which is a good place to be. Well, joining me now to confirm or dispel the prediction that it might cause chaos, Dr. Bharat Pankania. He's senior clinical lecturer at the University of Exeter Medical School and a former public health consultant in communicable disease control. Welcome to Times Radio, Dr. Bharat. Thanks for joining us.
Good evening. Hello.
Hello. So your take on the festive 5-day break in restrictions, is it going to cause more trouble than it's worth?
Oh, my concerns are that it may cause trouble. And the reason why I think this is, whilst the case numbers have come down with the lockdown number 2, they're not sufficiently low down for us to say lift restrictions and we can interact with our fellow human beings. So with the background level of viral activity quite high, and then we're heading up towards the festive season, and we know come 2nd of December there will be easing of the lockdown, so greater chance of having infections despite the tiers, the 3 tiers that we have. And then finally, come the 23rd of December, all restrictions are off, and that worries me.
Okay, you obviously have a scientific background, and that's where your worry will be coming from. But is there any evidence to show that this is not a good idea?
Well, we have a lot of evidence, and the simple evidence to show is as soon as we resumed activities after lockdown number 1, so schools, colleges, universities, work, employment, and all those economic activities started, go out to eat out and help out and all those expressions, our case numbers started to climb, and then they started to shoot up. So it's as straightforward as that. As soon as human activities recommence and you've got a background level of infected asymptomatic people, it is easy to get infected and then generate new cases and so on.
What about the argument that for people's mental health, for people's well-being, it's worth doing this? Because Boris Johnson will have thought long and hard about the consequences and has ultimately decided to go for it.
I would counter argue. I would counter argue, and I would say Prime Minister Johnson has taken a easy decision. I agree that this is very restricting and annoying, and mental health and everything else is affected. But there are ways around it. So, for example, if you look at what Angela Merkel has done for Germany, she says restrictions continue over the Christmas period. We're nearly there with respect to in the new year, we expect a number of vaccines to come online. And we've done a lot of work and we've done a lot of painful, expensive work in having lockdowns. And to just undo quite a bit of that over the 5-day period is easy decision making, to be honest.
Will you be spending Christmas with your family, Dr. Barrett? What's it like for you? You're very outspoken, about this.
Yes.
I feel sometimes that as a journalist, I need to be setting an example. Yet there's
No,
another side of me that just says, I want to see my family.
No, I really want to share this with our listeners now that you've asked. So I hope my children are not listening to this.
Okay.
So what I did was I said to my daughter, I'll have a meal ticket from you as my Christmas present. And so she gives me a piece of paper with saying 1 meal for dad. I'm going to cook you a meal. So I said, listen, India, that's my daughter's name. You cook me 2 meals sometime in the year, and daddy will take you out for a really posh meal sometime in the new year. The deal is daddy pays for the meal when we go out and you have to dress smart. So that's the deal I made with my children. And the reason why I did that is I don't want them to go shopping for presents because going out shopping, etc., is also at-risk activity. So that's what I have done. We will only be ourselves at home, no gatherings, nothing. And normally in Bath, I am a party king. I call a lot of friends to our home, and I will be missing that.
Oh dear. I think a lot of people will. And of course, for many people, the three household rule doesn't mean an incredible amount of people, although of course the risk is more. What about the argument that actually with a vaccine around the corner, um, we basically deserve a break, is what people are saying. The vaccine's close. We can do this now.
No, you can't, because when we hear ridiculous statements like, for every day of freedom, you have 5 days of restriction, what those modelers have not thought of is for the people who pick up a infection and get severe illness and are damaged for life, that's meaningless. For the people who develop severe illness and die, that's also meaningless. So, in the interests of protecting as many people as we can as a public health measure, I feel that little pain of having a low key Christmas will pay big dividends in 2021, because I want people to celebrate 2021 properly, and many of us, rather than lose anyone. Because if you talk to people who've lost loved ones, etc., there is a lot of um, under the radar anger, resentment, and that will start to spill over if we're not careful.
And from a public health perspective, of which you have obviously a lot of experience, what is your opinion on the new tiered system? Do you think that works? Is it not harsh enough? Is it too confusing?
It's difficult to implement and enforce. So if we take the example of, for example, Bristol, which is in tier 3, and then Bath, where I live, next door, is in tier 2. And we know that there is a very fine line between Bristol and Bath. And what happens in Bristol can happen in Bath too. So it is very difficult. And my view would have been have a bigger geographical area, in other words, a bigger fire break. And really, it is artificial to have Liverpool and Manchester in different tiers, or Bath and Bristol in different tiers. And then one more thing, we've had MPs moaning that their case numbers are low and why are they in high tiers. And to them, I would say you need to look at not only case numbers, but other parameters for your region or for your area, before you say you want to be in a lower tier, because you may have lack of hospital capacity, you may have a greater elderly population, and all those lack of or excess resilience that allows us to say which tier you should be in.
Well, Sage have said that they don't think anywhere in the country should move into tier one before the spring. We've
I
heard from
agree.
government that well, yeah, and we've heard from government that actually areas could move between tiers before Christmas. So anyone currently in a tier three region has been told, well, you could go into tier two before Christmas. But again, is this just dangling the carrot and causing more upset when it doesn't happen?
It is, and this is why I prefer to say up front that if we have strict restrictions, etc., adherence to infection control policies, we will get out of it faster and sooner, and then be able to carry on with our lives. And I always refer back to look how South Korea, Japan, Vietnam, Taiwan have managed their outbreak. They went in hard, fast, and early, and as a result, they're out of it much sooner than ourselves.
All right, we'll appreciate your point of view and your
Thank you.
expertise on that. Dr. Bharat Pankania, thank you, Senior Clinical Lecturer at the University of Exeter.